If you didn't know, now you will. Did you know that under federal rules that took effect earlier this month, healthcare organizations now have to give patients access to their full health records in digital format? So no more long delays, no more fax machines, no more charges for printing those pages. But here's a question for you. How soon will we be able to access those digital health records? And is this a real game changer? Are people worried that it's going to be too accessible to other people? HIPAA, like any worries about HIPAA violations, things like that. So we wanted to get some perspective this morning. Joining us now back on the show is Paul Seegert, who's a managing partner at PCS Advisors, which is a health benefits consulting firm with 35 partner offices across the country. Good morning, Paul. Welcome back to the show.
Good morning. How are you?
I'm good, thank you. How are you doing?
Doing great.
So tell us, Paul, first of all, what did you think about this big shift? I mean, this is a big deal, I think.
I think it is the start of a big deal. We've got a healthcare system that's historically has not done a good job of giving consumers information so that they could be good, engaged consumers, and a lack of access or practical access to medical records is part of it.
Why do you think it's happening now? Yeah, why now to go digital?
Well, there's been a big push in the whole system to go digital, so that because it impacts cost significantly throughout the system, and continuity of care, so outcomes can be better, and redundancy of care is another issue. If you have care done at one facility and you go to another facility, outside that system especially, it hasn't been very practical to take your information with you. And in fact, as consumers, lots of us haven't even known that was possible. And it practically, it was legally possible, but it could take 30 days. You might have to go pick up a paper copy in person. It was really out of date.
So when they say health records, what exactly do they mean? Do they mean like the records that our doctors have when they check through them every time we have an annual checkup or something?
Right. Yep. Right on down to the notes that a doctor might take during your visit. Maybe you have a surgery, they're talking to you post-surgery, or you could even have access to the notes that they took around the procedure. All of it is, in theory, going to be available to you now. Now, it will come down to implementation, like so many of these things do. If you look at the hospital transparency rule as an example, that was actually part of the original Affordable Care Act. One of the good parts, I think. We need more transparency in general in our healthcare system. And hospitals were supposed to start publishing their pricing for 300 common procedures. Here we are all these years later. The industry pushed back against it, delayed it until January 1 of last year. And as of this moment, if you look at all the locations of the three largest hospital chains in this country, they're at 0.5% compliance. So there's a lot of industry pushback against these kinds of things. We see that also here. American Medical Association, Hospital Association, and you can keep rattling off more associations of that type have pushed back against this and have delayed it before. Quite a few times. It's been delayed for most recently 18 months at their request. So I think we'll face more delays in terms of implementation, but I'm glad to see that we're moving in the right direction.
So when you say delays in implementation, you mean that there could be one state that rolls this out in the next month, but others that could roll it out within the next year? Like it could totally vary.
Yeah, I think it'll even vary by system. You have a real disparity between providers and healthcare systems as to how modernized their own systems are. And so the rule says, really, if they have it in that format, you should be able to access it in that format.
So that's really interesting, Paul, not to cut you off, but like if you're somebody who is with, one carrier, if you're an Anthem Blue Cross or something, but you're somebody else who's with Cigna, you could be seeing that your friend who has a totally different policy, maybe Anthem is on it and they roll it out within, the next few weeks, but your policy, because it's totally different with a totally different carrier, you may not see that option for several months. Is that what you're saying? That's probably more likely than state to state.
Yeah, exactly. And then also within healthcare providers, so maybe one hospital system another,
Oh,
or provider
interesting.
group versus another. And the other issue you're going to face is that there are a lot of different systems out there. So the format, could be very different. So it's going to start out it's kind of a mess, like a lot of these things do. And I think they're actually allowing for that to a degree because they don't want to over-regulate and say everyone has to do a certain format, get it wrong, require a massive
and then have to do a total
industry to change.
overhaul. Yeah, that makes a lot of sense. Okay, that's really interesting. So even if you get into a groove of, okay, this is how I'm going to access these accounts, it could very well change. It could change in the near future because maybe that's not the universal way that it's chosen to be across all carriers or across all healthcare networks.
Exactly. And there are legitimate concerns around privacy and protection of data. That will all have to be sorted out. It's not as though we don't have the technology to protect information. We do it across other industries. So in some cases, that pushback is legitimate. In other cases, maybe not so much. So that'll get worked out as well. But I think ultimately, as a consumer, we need to be able to get our information and go and travel with our information throughout the healthcare system, just like we do in other things. If you want to change cell phone companies, you can take your number with you. It's that same kind of consumer freedom that we need and empowerment that we need in healthcare. We times where you have a consumer that's in an HMO type system that would like to move out of that system to go get care when they get a big diagnosis, but it just can be such a hassle that they remain there because they don't want to have to start over. And they don't even know necessarily they can get their records. When they try, it's difficult. So I think there's some positives that we'll see.
That's a really good point, Paul. And I love how you said, if you want to get a new cell phone, you keep your number, contacts, everything that comes with it. Or even like bank accounts. I mean, my gosh, there are so many Americans now who do all their banking online. And I'm sure at first, and even now, there are people who feel like, what about hackers? What about, violations? But it's a risk that makes it. I know for myself, I was very worried to do online banking, but man, it has been a game changer to make sure I pay my bills on time. So, I could see where this is a real game changer as well. I really appreciate your perspective, Paul Seegert. Thank you so much for your time this morning.
Thanks for having me. Have
Absolutely. You too. And again, Paul is a managing partner at PCS Advisors, which is a health benefits consulting firm with 35 partner offices across the country.